Vanakkam, good morning. In this video, we are going to discuss about the blood transfusion. Blood transfusion is transfusion of blood from one person to the another person via injecting through vein. It is a life-saving procedure. It should be carried out when absolutely essential. So healthy donor must be aged between 18 to 60 years. The hemoglobin value and packed cell volume value should be normal limit. Donation can be given once in 6 months. Before doing the blood transfusion, proper blood grouping, typing and cross matching must be done. Indications of blood transfusion are the blood loss, severe blood loss occur in the accident, emergency surgery, severe peptic ulcer, bleeding piles, and blood diseases like hemophilia and thrombocytopenic purpura and leukemia. These conditions can be given the blood transfusion. The severe anemia, to increase the oxygen carrying capacity of the blood, routinely we are giving the blood transfusion. And operative procedures, during the operation we expect the severe blood loss means we will arrange the blood. And circulatory shock condition, we can give the blood transfusion. And exchange transfusion in the newborn given for the severe jaundice. We can exchange the whole blood. For blood transfusion, proper screening for the diseases like malaria, syphilis, hepatitis B, acute immunodeficiency syndrome, otherwise called as the AIDS, should be done. And before the transfusion, bringing the blood to the room temperature, that will avoid the allergic reactions. And aseptic measure for collection as well as the transfusion should be done. Before the blood transfusion, we have to check the blood bag. So in the blood grouping and typing, which patient we have to give this blood bag, everything we have to ensure before the transfusing the blood. So avoid the mismatched transfusion. The cross matching must be done before the blood transfusion in the blood bank. The major cross matching, the recipient plasma is matched with the donor red cell. So this is a very important. Routinely we are doing the major cross matching in the blood banking. So in the major cross matching, the donor O group means they can give the blood to the O group. So the no mismatching. So all the cells are clear. So mismatch, if we give the donor group is A, recipient group is O, means it will produce the agglutination. So we cannot give. So O group we cannot give the A, B, AB. See, produce the agglutination. Like that, the A group we can give for the O blood group and A group, no agglutination. Here it will produce the agglutination. So we should do the cross matching. So whether the cells are clear means we can give. If the agglutination is present means it is antigen antibody reactions will occur. So it will produce the allergic and anaphylactic reactions. So we can avoid the blood transfusion. So cross matching is important. In the major cross matching, recipient plasma is mismatched with the donor red cell. The minor cross matching, recipient red cell is matched with the donor plasma. So this is not important. It is minor cross matching because the donor plasma is around 300 ml. The blood bag volume is 300 ml. So 300 ml of the plasma is diluted in the 5 liter volume of the recipient plasma. So it will not produce any reaction. So this is minor. But we can do the minor cross matching for the large volume of the blood transfusion. Types of blood transfusion. The whole blood we can give for the circulatory shock, accident, surgery cases, we can give the whole blood. And blood products like packed cell we can give in the severe anemic condition, and the platelet concentrates we can given in the thrombocytopenic purpura. WBC we can given in the severe infection. Clotting factors we can given in the clotting factor deficiency like hemophilia. The blood bank storage, the blood stored at the 4 degrees Celsius for the 4 weeks. 1 unit of the blood contains 300 ml of blood. In the 300 ml of the blood, 250 ml is blood, 50 ml is the anticoagulant. Anticoagulants routinely used are acid citrate dextrose solution, that is called as the ACD solution. It contains trisodium citrate, dextrose, distilled water. pH is around 5.4. It stores the blood for at least 21 days. It provides maintain the pH, give the energy for the sodium potassium pump, and maintain the cell volume and size in the blood, and prevent the fall in 2,3 diphosphoglycerate level. Another one anticoagulant is the citrate phosphate dextrose adenine. This adenine is helpful to store little more time compared to the acid citrate dextrose solution. Effect of prolonged storage of the blood is it increases the plasma potassium level. So we cannot use the long storage blood. So it will produce the hyperkalemia, and it also increases the prolonged storage, increases the intracellular sodium level, increases and increases the intracellular water level. It will alter the cell size and shape. So it easily prone for the hemolysis. We cannot give the prolonged storage of the blood, and it is also more than 24 hours no viable WBC and platelets are available. So for the conditions like thrombocytopenia and severe infection, we can give the transfuse the blood immediately after donating the donor. Then only we can get some amount of the WBC platelets from the donor to the recipient. And prolonged storage decreases the 2,3 diphosphoglycerate concentration. The prolonged storage will decreases the RBC count also. Blood transfusion reaction is the separate 5-mark question. It is frequently asked in the university examination. So blood transfusion reactions. So matched blood, when we give the matched blood also sometimes produce the reaction. So that is called as the transfusion reaction. It has the two types, immediate and delayed type. In the immediate, what are the reactions occurs? Immediately we give the matched blood to the recipient. So allergic reactions like rash, urticaria. Urticaria means we can itching and rashes all over the body is called as urticaria. Okay. And pyrogenic reactions. Pyrogen means the fever producing agent is called as the pyrogen. So it produces the fever and rigor. Rigor means shivering. It will occur immediately. And circulatory overload. If you give the more amount of the blood within the short period, it will produce the circulatory overload. So it will produce the breathlessness, and in some conditions it produces the pulmonary edema. Hyperkalemia. Hyperkalemia also one of the immediate reactions. If we give the prolonged storage blood means it will produce the hyperkalemia. Hypocalcemic tetany also the immediate reactions occur in the some patients. The delayed reactions, transfusion reactions are thrombophlebitis. When we give the blood through the vein, that puncture site, the cannula site is inflamed and thrombotic. Thrombosis formed in the inflamed vessel wall, so it will painful. It decreases the flow of the fluid through this IV cannula. So that is called as the thrombophlebitis. This is the commonest condition in the hospitalized patients when we transfuse the blood. And transmission of the disease, if we give the unscreened blood means it will produce transmit the diseases like HIV, syphilis, malaria. So routinely we have to screen these diseases, hepatitis B. So we should screen these diseases for prevent the transmission. And hemosiderosis, if we give the blood frequently in the larger volume means it will produce the iron deposition. Iron deposition occur over the liver, pancreas. So it will, that is called as the hemosiderosis. Liver, heart, pancreas deposition of the iron is called as the hemosiderosis. The mismatched transfusion is different from the transfusion reactions. The transfusion reaction we give the matched blood. We do the cross matching and we give the blood in the same group. O positive means O positive, A positive means A positive. But the mismatched transfusion means we are giving accidentally. It is not accidentally, suppose due to the human error, sometimes very rarely we can give the some wrong blood to the one patient due to some mistakes of the human error. That condition will produce the severe reaction, that is called as the mismatched transfusion. So normally we do the cross matching and check the blood bag and recipient case sheet, then only we can give the blood. Sometimes, very rarely, due to the mistakes of the hospital workers, so they give the wrong blood group for the patient means that will produce the severe reactions. That reactions are called as the mismatched transfusion. Immediately it produces the severe hemolysis, lyses all the cells due to the antigen antibody reaction, and circulatory shock. The blood pressure is drastically decreased, less than 70 millimeter mercury. That is circulatory shock, and acute renal failure. This is the immediate effect of the mismatched blood transfusion reaction. Delayed reactions are jaundice, severe jaundice will occur. How it will occur in the we can see in the next slides. We give the mismatched blood transfusion blood to the recipient means the accumulation of the donor RBC with the recipient plasma, it blocking of the small blood vessels, it obstructs the small blood vessels, it produces a tissue ischemia, it decreases the blood supply to the particular part of the vital organs, and the release of toxins also. The antigen antibody reactions release the toxins and produce a renal vasoconstriction, and decreases the renal blood flow and decreases the glomerular filtration rate, ultimately lead to the renal failure, and circulatory shock will occur, and hemoglobin appear in the urine due to the severe hemolysis. When the hemoglobin is filtered through the renal tubules, it produces the renal tubular damage by the acid hematine due to the hemolysis, and acute renal failure occur, and uremia, hyperkalemia, urea level is increased very much, potassium level is increased very much, it leads to the deaths. Delayed reaction of the mismatched blood transfusion is the severe jaundice. It is occurred due to the severe intravascular hemolysis. It is due to the antigen antibody reactions and acute intravascular hemolysis occurred due to the complement system, and delayed is due to the hemolysis it will occur. Summary: the blood transfusion is transfuse the blood from the one person to the another person. So we should do the cross matching. Then we have to give the blood. We have to keep the blood in the appropriate temperature. So in the transfusion reaction is more common. So matched, you give the matched blood also, it will produce the transfusion reaction. Transfusion reaction is the important short notes. Sometimes accidentally we can give the mismatched blood, that is also produce the severe reactions. So in the blood transfusion is the important short notes. The mismatched blood transfusion reactions and transfusion reaction separately can ask us the short notes. Thank you for watching this video. If you like this video, share your friends. Thank you once again.